Here we are talking about primary care medicine. Just got done with my run. Encouraging people to exercise is part of primary care medicine. So it's appropriate that I haven't showered yet, but that's okay because on YouTube, you wouldn't know that unless I told you. I guess you could tell by looking at me, but we'll find out about that. So we're glad to talk about not specific things. You know, this isn't totally directed about what the subject matter will be. You guys can help direct it. So right now we have Neumed saying hi. We have Candy Lover 101 saying hi. Hi guys. And if anybody wants to use the super chat function, if you know what that's about, that's available now on our channel so that you can get your message higher or more noticed if you feel really strongly or want to support Auburn Medical Group video productions. Yes, Alexis, hi. Jamie, hi. Good to see all you guys there. Carla. So yeah, I've got everybody covered there. But not everybody's watching. We have over 41 people already watching just when we first start. That's pretty encouraging. Hi from British Columbia. That would be Norma Jean. I'm not going to sing the song because I'd be starting with Goodbye, Norma Jean. Was it Goodbye, Norma Jean? Is that how it goes? Goodbye, Norma Jean? Or, anyway, yes. Hello, Norma Jean. Georgia, hello. And Michelle Dreyfus in Missouri. I actually spent 7 years of my life in Missouri. 4 in St. Louis and 3 in Kansas City, medical school and residency. And so if you guys want to talk about kind of some of the things we cover in primary care medicine, that's kind of the subject. A little bit closer to home, Kimberly Monroe in California. Hi. And of course, BooBoo Kitty, one of our honored patrons. Yes, BooBoo, we see you. Thank you for being a part of things. And Sarah Milton, another familiar name from the comments sections. I recognize you. Somebody asked, are you all a part of their group? Neumed, I'm not sure what that is. Okay, somebody just did something. Who was that? And what was it you did? Hey, I think it's just an arrow showing that I can find the messages if I go down. Lisa Lujan, got your notification again in Dallas. So welcome back. Yeah, we spoke last week when we did one of these live chats. And okay, so bit of an experiment here still getting used to YouTube Live. It's a bit new. I'm sure it's a bit new to all of you too because it's a fairly new function of YouTube. And XOXO, Brit XOXO, hi. Yes, hello. Waiting to see if we have any of those special super chat messages yet. Not yet. We might see one. We'll see. Favorite, okay. Somebody's got a very specific question. After I say hi to Tammy from Maryland, I will address Brit XOXO's favorite extractions, and hi to Hannah in Wyoming. Favorite, specifically extractions. So you're talking like ears or blackheads. Be specific. Or I'll go ahead and go with both of them. Blackheads, I'd probably say the very first blackhead video we put out, which actually was not a blackhead at all, it was a dilated pore of Weiner, the very large one in the lady's back. That was pretty good. Oh, you're saying anything. Ears, I would have to go with one of the 2 ear videos that's in the millions that we've had. One of them was with Jim, the fellow with the short red hair and the beard. And then the older man who, when I asked him how the cleaning went of his ears, he says, "What'd you say?" And he catches me off guard because I thought he actually couldn't hear me. Maybe you guys have seen that one. Those are my favorite ones. And Carl, hello. The reason I talked about or titled this about primary care being about a lot of things is because of how the day went today. Today was one of those days where I see patients in both morning and afternoon, so a full day, and had real simple things, had difficult things, had difficult interpersonal things, which even though I seem like an easygoing guy on video, there are times that people can get me riled or get my goat, and I have to keep my cool. And just like any line of work where you deal with people. BooBoo Kitty says, love it when your patients catch you off guard. Yes, and you've seen that in a few of the videos. Like, who is it that said something about using gin? And it wasn't. She didn't actually mean gin, but it sounded like she talked about drinking gin to keep her ears clean. The ear one was funny. Last year video, yes, the last year video was good. And we've got Lisa's friends here. You guys know Lisa from previous videos, like last week when she did the blackhead on my back on one of these live ones. I didn't know she's having friends over tonight. Okay, getting caught up on what you guys are saying. That's what happens when I'm not talking and I'm looking down, looking below. What are your favorite types of videos? My favorite types, I'll tell you what, blackheads are not my favorite types. I mean, they're fun, but if you guys have noticed, I just get they get watched a lot, and so I get a lot of comments from people who aren't usually part of our channel, and the comments can be very very critical, but they're deserved. I mean, this last one, it was all about our filming technique, and the problem was it was shaky and a little bit out of focus, and that happened because I was going rather quickly because there were a lot of them to do, and Ian, trying to keep up with the camera, actually used two very different techniques that you guys would be unaware of from watching. One of them was to use a stabilizer, but the problem with the stabilizer is whenever the camera's out of focus, he had to actually touch it to get in focus, and that makes the stabilizer go crazy. It wiggles around. So we took it off the stabilizer in the middle of it. And you guys don't know this because it's edited out. And then after that, he had the problem of following me because I was going really fast doing a lot of these blackheads. And we were going so fast that people said it made them feel seasick watching the video as I go from blackhead to blackhead to blackhead. So I had to read all of the comments that people made about, feeling seasick and such watching those. Let's see, what did Sarah Milton just say? My favorite earwax removal was the most recent one because it was never ending, but the funniest one would be the elderly man that caught me off guard. Yeah, I agree with that. And welcome Dolores from Vancouver. Jamie, 1178, is there anything you have encountered that you really made your skin crawl or just made you sick? Anything you had a hard time handling? That's kind of an easy one. Sometimes people have constipation so terribly severely that nothing gets it out, and you have to manually go in and disimpact. And that's only happened in our new building, I think one time maybe, and really only a couple times over the 10 years we're in the previous building. So thankfully it's a very rare thing, but yeah, I can gag during that particular procedure. Oh, thank you for BooBoo for your comment on the blackheads. And Mal Yaretz wants more cis, and Brit XOXO, do you like memes? No, I don't. Cheryl McNutt, ew. Yes, it is ew. Absolutely, that's appropriate. BooBoo, ew. No poop videos, please. Yeah, we had a procedure today. It was actually an injection in the ischiogluteal bursa, and I thought, well, we can make a video, but no, let's not show somebody's bare bum on the video. Hello from Georgia. Missed beginning. We didn't cover a whole lot yet, so you're okay. Except I made some comment about if anybody wants to use the super chat, that's available now, but nobody's using it, so everybody gets attention now. It's kind of a democracy, so if you guys all unionize and nobody does it, I'll try to read all of your comments. Hannah, ever had to remove gout? Have you ever had to remove gout? My mom had it removed from her. Oh, we did put a picture of somebody who had gout crystals coming out of their toes. Maybe as a video. Some of you guys may remember. If anybody remembers seeing that, please comment. When we actually had the gout crystals that you can see. I think it was a picture that we put on the Facebook page, I think. Hi, Naomi. LeeAnn's friend Naomi is here. What super chat? Favorite part of your job as family doctor? It's crazy to watch. Super chat. Super chat was put out by YouTube recently, where when you're doing your chat, you may see a way of doing it other than just writing, and people can actually pay money to get their message here, like you guys are putting those messages in, either highlighted or it stays up, so it gets the attention of the person doing the live YouTube, and that way you're more likely to get addressed or get your comment read. And this applies more to when there's so many comments going through that the person doing it can't keep track of all of them, and they get the money. So who says no to that? But it looks like we don't need it for this style because I'm able to keep up with everybody. So that's good. Favorite part of your job? Favorite part is relationships with patients. Family medicine, you have these relationships for a long time. It's not like a specialty where whatever the problem is, it gets taken care of, and then the doctor doesn't see that patient anymore. We go lifelong in our practice. We've had many patients with us spend first part of their lives, middle part of their lives, end of their lives, the whole spectrum, and even generations. We've had 3, and I keep trying to say 4 generations of one family. I'm trying to think if we've had which family. I don't think we've had the 4th generation, but we could if they'd bring their kids. I think they have a pediatrician, so that's why they haven't come yet. But definitely some 3-generation families in our practice. You know these people, you know their families. Many of them are families I grew up around because I'm in my hometown. And it's kind of nice that it's family on our end too, with Gwaine being my nephew. From our family to your family. It sounds kind of corny, but I like it. Okay, get caught up on some comments here. No, you haven't missed much. Not nice, Cassie. Okay, somebody was not nice. Oh, let's see. I wonder if you have the ability on this to remove people or block them. Haha, you can. Thank you, Cheryl. By bringing that to my attention, you showed me how I can block people. And Hannah, well, it's been taken care of now. So haven't done that since the Periscope days. Some of you guys were around then. Medical cannabis. Medical cannabis, that is something I've done a 180 on in recent years. We were all taught just all the evils of marijuana. All of us were growing up. And there's reasons that that's the message that was given. And that's the reason that even for the most part, the medical community even held that opinion. And it had to do with information, what information was available. When a drug is a class 1 scheduled drug or schedule 1, you can't do medical research on it. It's forbidden. And marijuana is Schedule 1. Therefore, doing research with it is forbidden. At least, it may be true across the board. It may not just be federal dollars. It may be all the way across the board. I'm not sure on that. I'd have to check the policy. So there's not a lot of information on it. So the only information we had was any studies that had been funded before there was complete prohibition on it. And those studies that were funded were ones that were designed in such a way as to give the expectation that it was going to make it look bad. So you had a lot of these studies being done that going into it, people already had the thought that the marijuana is going to come out looking bad. So now that we're getting a little more information on it from a lot wider use, because people have been using it more and more, and even when they use it illegally, you can still study it, study the illegal use of it. And now that it's legal in a lot of ways, we're getting even more information about it. So we get the data, and what we're finding is it's not as bad as it had been made out to be. And in fact, there's few things that we have concerns about. We do not have as great a concern for lung cancer with it as we used to. There is some evidence that may actually be helpful in some forms of cancer. Definitely is good for some forms of glaucoma. There are some actual pediatric seizure conditions that it is very good for. What's bad about it? Well, there are people that really do seem to get hooked on it. That does not seem to be a problem with people who started in older age, like over 21, 23, somewhere around there. It doesn't seem to have that same problem of the dependence on it. And the dependence problem actually doesn't seem to be that big of an issue either. Some people are very dependent on it, of course, but a lot of people are able to use it and take it or leave it. The other concern is this. It's hard to put down, and a lot of studies have a hard time really demonstrating it, and that's the demotivation. Maybe you guys are familiar with what I'm talking about. Imagine the person who doesn't care to do anything but smoke marijuana. Now, is that because the marijuana did that to them, or is that the kind of person that ends up in that situation where they just smoke marijuana all day and that's all they do? Bit of a question as to which is the causative factor there. So there's some concern with that too. But as far as it hurting a person's body, not a whole lot. Surprisingly little. To the point that I'm now telling patients who have situations that it seems to be a good treatment for, I will tell them, go ahead and get your medical card and do it, and be in touch with me and let me know what is going on and keep me very informed on it. So I do. I have one older lady who's using it for her arthritis and fibromyalgia pain. Seems to be doing well with it. Actually, I'd prefer for it to be even better so that she didn't have to take other medicines for the pain. So I'm a little disappointed in its performance for her. And just watching it in some of the other patients. Now, are there people who abuse this idea of medical marijuana? Absolutely. There's people who just want to get stoned and they'll say, I need it. I'm having trouble sleeping. Authorize me to have more marijuana. You know, that thing absolutely can happen. But there is a place for it in medicine, and I'd like to see the Schedule 1 classification of it change so we can get some data on that. That was my official stand for legalizing it in California. My official stand was, no, let's not legalize it yet. First, let's make it no longer Schedule 1 and get some real research out so that we can know what we're using, and then consider to make it legal after we know that. So that was a good question. We certainly talked a long time on that one. So we'll get caught up on some questions here. As the BooBoo Kitty said, isn't medical marijuana more quality controlled as far as strength? One would hope so. But the answer is no. There really is nobody looking at it and making sure that it is of a certain grade of quality or safe from pesticides or other chemicals put on it. That's not yet being done. The California law that went through is supposed to include that to be done. So hopefully it will be. All right, get caught up with some people here. Cheryl, my son goes into manic episodes on it. Yes, you bring out a good point. Some people have very bad reactions to it, but it's the exception, not the rule. There's also the people that have the horrible paranoia and anxiety that marijuana causes. And yeah, you don't want those people using it at all. And yet other people treat their anxiety with it. And more often it has an anxiety alleviating effect rather than aggravating it. Okay, let's get down here to Cajun Tinkerbell says, I love your answer. Thank you for taking the time to answer my question. Oh, was that your question? You are absolutely welcome. Thank you for asking a good question that something I've been thinking a lot about and working with. Do you see many patients with Ehlers-Danlos syndrome? Not even one. And, is it underdiagnosed? maybe that's why I don't see any, because I don't diagnose it. Jawbag998, where do you get that otoscope that attaches to your phone? I need it. You need it? That raises questions too. It's from a company called CellScope, I believe. CELLSCOPE. And you just search for them. You'll find their website. They sell them. I think they're around $300 now. They raised the price when they found out they could. They were actually marketing them to the mothers of young children. I'm sorry, that's very sexist of me to say the mothers, but hey, we all know that that's what it was. Parents of young children. And I don't know if it really caught on. And then they also marketed them to doctors. And of course, you've seen how much I use it in clinical practice and for making the videos. Wonderful tool. BooBoo Kitty, Pam had a good question about back surgery earlier. Okay, let's back up and find Pam because BooBoo liked it. Pam. Oh, what's your opinion, spinal surgeon or neurosurgeon for scoliosis surgery? Interesting question. Thank you, BooBoo, for pointing me to Pam's question there. So spine surgery is done by spine surgeons. Spine surgery fellowship is entered by neurosurgeons and orthopedic surgeons, because they are operating on the spine, the skeleton, and inside of it is the spinal cord, and out coming from it are spinal nerves. So you have this cross section of neurosurgery, which includes the entire nervous system, but mainly the central nervous system, which is the brain and spinal cord. So neurosurgery. Orthopedic surgery, the entire spine is bones. It's part of the skeletal system, and they're going through muscles, musculoskeletal system, which is what orthopedics is, to get to the structure through which you have spinal cord and nerves coming out. So a spine surgeon is either an orthopedic surgeon or a neurosurgeon. They both can go on and do a fellowship in spine. So if you're going to have your spine operated on, it will be a spine surgeon, whoever it is. They will be either a neurosurgeon or an orthopedic surgeon. Now, is one better than the other? Well, they both train in the same fellowships. So it's the same either way. It's just two doors into the same specialty. And there's a lot of areas of medicine like that. You might be surprised how many there are where two specialties overlap to the point that you could have somebody from a completely different route getting to whatever it is they're working on. Here's another example. Facial surgery. Well, you've got oral maxillofacial surgeons. You've got ENT. For the skin, you have dermatology. And there are procedures that all three of them are totally appropriate to do. And I would not say for many of the procedures they're doing that a particular specialty is better. There may be a particular program that's stronger in a particular procedure, or a particular surgeon who's better at a specific procedure. Now, oral maxillofacial surgery, this is interesting. At the hospital I trained at in Kansas City, they had a dental school there. And they had a lot of their dentists who would enter the OMFS, or oral maxillofacial surgery program, at that hospital. And when they would, many of them would come in as a dentist straight out of dental school. And then they would do 2 years of training. And with those 2 years combined with having their dental school, be able to get the degree medical doctor, MD. And then they would go on and do the however many years it was. It may have been 5 years. I'm not sure. Maybe been at least 5 years of residency in oral maxillofacial surgery. They'd come out of this program, an MD DDS, having done the residency in oral maxillofacial surgery. They could get privileges at a hospital. After all, they are a medical doctor, and do these procedures. Interesting way to get in if you want to do, operate on the face and do plastics. Interesting route to get to that through dental school rather than medical school. It may have been a little bit easier for them to do it that route. I don't know if maybe there's a difference in test scores and the competitiveness of the two. That may have been part of why they would go that way rather than just going to medical school. I'm not sure. Okay, back to you guys here. BooBoo. Ask again your question, Rosalie. Well, I'll just back up. Rosalie. BooBoo, you are a great moderator, by the way. Rosalie Worley, can you explain a subarachnoid hemorrhage? Is it really rare to survive? Okay, subarachnoid means underneath the arachnoid. The arachnoid is a layer over the brain. The brain has 3 layers, and they're all called mater, which means mother in, who knows what language that is? Mater. Is that Latin or Greek? Anyway. So, first you've got the dura mater, the tough mother. Dura, like durable. Dura mater, tough mother. It's a good way to describe something. It's a tough mother. Okay, so the dura mater is the outside one. And then you've got the arachnoid, which is kind of looks like a web. Arachnoid, like spider. So it looks like kind of a web, not as tough as the dura mater, and that's the next layer down. And then the layer that's right on the brain is the pia mater, and that's very delicate. And I don't know what pia means. Maybe you guys do. So 3 layers: dura and arachnoid and pia. And so you may hear things like epidural. Well, epidural is outside of the dura, around the dura. And so there's epidural anesthetics or epidural anesthesia, where a drug is given just outside of the most outside layer of the brain and spinal cord to affect it. There's also epidural hemorrhage, and on a CAT scan, you'll see that there's the brain, and then there's a big blob of blood between the brain and the skull in one part. That's an epidural, outside of the dura, hemorrhage or bleed. And then there's subarachnoid hemorrhage. Well, that's on the other side. That's under the arachnoid mater. And that is when you get blood all over in the brain because it's under the covering of the brain. And that happens with like a spontaneous bleed, like when somebody strokes out, they have a blood pressure of 230 over 120, something like, or even higher. And a blood vessel actually ruptures and bleeds inside of the brain under the arachnoid covering, a subarachnoid hemorrhage. Bad outcomes quite often. When you have all that bleeding in there, it pushes all the brain out. And so all the other side of the brain from it gets squished over and it damages it. And it compromises the blood supply because all that pressure leaking in there, you have to have even higher pressure pushing blood in. And so you'll see people with ridiculous blood pressures that you would never even imagine seeing, at least not in a conscious person. And here's another thing about it. When we get those patients in the emergency department with sky-high blood pressures that cause this bleed, we don't lower the blood pressure. Because to give a medicine that lowers the pressure of the blood going to the brain guarantees that the brain will not get perfused by blood. So you actually let them have that high pressure and reduce it slowly. And you have to evacuate the bleed. So that takes an operation to actually go in and drain this high pressure bleed that is pushing against blood trying to get to the brain. So that's subarachnoid hemorrhage. And people do survive them if you get to them quickly and if they haven't bled too much. Stephanie Noble. Oh, Stephanie Noble's on here. Look. Stephanie, look who's here.
Hi. Wait, you should get my other friends here, too.
We should get your other friends here. Okay, Stephanie says, hi, Dr. Vaughan. This is a good live video. Well, thank you, Stephanie.
Hey, Emma, Naomi, and Katie are here, too. If you want to say hi.
Okay. I love your work, your wok and vids. I actually don't cook much, and I don't use a wok when I cook. But yes, thank you for appreciating my work. Thanks, I'll appreciate the prayers. Oh, yes, absolutely. Somebody has a family member with a subarachnoid? Is that what that is? Epidural hemorrhage videos are kind of cool. Amazing how they are treated. Good luck. Boy, something was going on with Pam. Everybody's saying good luck. I'm praying for Pam. Thank you, BooBoo Kitty. Facing huge 2-day surgery. Unsure which doctor to go with. This is secondary scoliosis after back surgery in 2002. Oh, Pam, yes, we do wish you the best on that. Okay, getting back caught up to you guys. And yes, hi, Trenton, we see you. Pam, Cheryl, yes. Stephanie. Working with clinical pharmacists. I love clinical pharmacists. They are so helpful. And they have a good knowledge of the pharmacology to help out. Actually, my experience has not been so much with pharmacists as PharmD, somebody with a doctorate in pharmacology rather than pharmacy. Usually that's who will be doing rounds with the doctors rather than the pharmacists themselves. But yeah, either one. Hello, doctor. Love your work in Viz. Good to see you going live. Hey, Omar. Thank you. It's good to see you here. I haven't seen you for a while. Oh, and Stephanie says hi, Lisa.
Hey.
And BooBoo Kitty gives you hearts.
Hey, BooBoo.
And Sarah's excited to see this. Watching zits and cysts explode makes my mouth water. Sarah, that's not everybody's response to it, but...
Sarah, I think you have a medical problem if your mouth is watering.
Oh, there's a PharmD on here. Casey, awesome. Yes, we love PharmDs. Mater is Latin. Thank you. Mater is Latin. Doing residency and ambulatory care. Casey, interesting. So your title of your residency is ambulatory care. I'm guessing it's internal medicine, but could be family medicine. Be curious to know. That's interesting. It's called ambulatory care. Love your videos. Thank you for sharing. Hello, doctor is in session. I'm a popaholic addicting. Sarah Bishop. Well, thank you guys. This was fun. Oh wait, did I see two people with the same name in there? Are there two bishops? Sarah Bishop. Sarah. Oh, it's just the same. Okay. Okay, cool. Hey, if anybody wants to try out that super chat function, have at it. Or actually, if anybody has and I missed it because I was talking about the subarachnoid hemorrhage, please give me the what for here if I did that. I doubt that I did it. Dealing purely with outpatient. This is the person that Casey's in ambulatory care residency. Casey, tell me where you are doing your ambulatory care residency. Well, I go back through the comments, make sure I didn't miss any super chats. Good. Okay. Okay. Yeah, Omar, thanks for letting us know. Oh, Casey's in St. Louis? Seriously? Well, whose program are you in? I went to SLU for medical school. And in fact, knowing what I do now, instead of going into emergency medicine when I graduated from SLU, I probably would have done what you're doing. And stayed in St. Louis, too, by the way.
No, you wouldn't.
No? You don't think it would have? No, I know I do. Yeah, it's wrong to say things like that. Okay. Department of Public Health. St. Louis College of Pharmacy. Oh, wait. Casey, are you the Pharm D? Doing my residency. Oh, you're a Pharm D. Okay, I'm sorry. Pharm D doing ambulatory. Okay. I was thinking you were a medical doctor. I didn't make the connection that you were the same person. Okay. Yeah, St. Louis College of Pharmacy. Somebody's relative was going there from my medical school class. Cool. Okay. No, so I'm sorry. I would not have gone into pharmacy. I would have done a residency in ambulatory care or family medicine, essentially. I probably would have applied to like St. Luke's or maybe not Deaconess. I don't even know if they have. I don't think they call it Deaconess Hospital anymore, but there was a hospital there, Kings Highway and Highway 40, roughly that area. The hospital's still there, I'm sure, but back then it was called Deaconess. And they had a family medicine residency. Dr. Bull did pharmacy or pharmacology. Yes, one of them. Oh, I'm sorry. Barnes is on Kings Highway. Okay. No. Not Kings Highway. Manchester? Maybe it was Manchester. It's been, how many years has it been now? It's been 21 years now, so it's been a while. Any advice on his I can help cleanse my boyfriend's... Oh, hold on, sir. Do you have any advice on his I can help cleanse my boyfriend's back properly to keep it from having extreme breakouts? He's an oil fielder and wears layers and layers of clothing, causing sweating. Yes, I have a suggestion, and that is wearing clothing that wicks the moisture away and changing frequently, changing the undergarment. Just like we recommend with athlete's foot, we recommend people have a clean, dry pair of socks to change into in the middle of the day, maybe even a dry, clean pair of shoes, because underclothes get moist and hold moisture. So wicking fabrics and frequent changes. Okay. Rosalie, do you have a treatment for restless leg other than 2 standard meds everyone gives out? Well, first checking somebody's iron level to make sure they're not low on their iron, because sometimes that will fix it before you get to prescribing medicines. Yeah, there's what are the medicines they're using for that? One of them starts with an R, the brand name does. Is it Remeron? Or is it Rosarum? I'd actually have to look it up. Another thing about primary care, lots of looking things up because we cover everything. So if you do something a lot, the names are right there in your mind. Usually there's some kind of anti-Parkinsonian medicine. And actually you can just use levodopa carbidopa, which is Parkinsonian medicine. Some people will use a benzodiazepine. Of course, anybody that listens to me a lot will know that I'm very much not comfortable giving out a lot of benzos. But Klonopin is one that some people respond very, very nicely to for restless legs. But then you're dealing with a controlled prescription, and most doctors these days are requiring you to come in quite often for controlled prescriptions. For our few patients who have something like the Klonopin, which I think I have maybe one patient that takes that for whatever reason, he has to come in every 3 months for it. Casey, thank you. Appreciate that. Remron, yeah, that's it. Except you misspelled it, but that's fine. During his 16-hour workday, he should change how many times? Sorry about that. Oh, well, however many times it takes to make a difference. Start out with just doing it once in the middle of the shift. And if that's just not making a difference, do it at a third of the way through the shift and then at 2/3 of the way through the shift, getting that undershirt change that's getting moist while working. And then using a strong antiperspirant, something like one of those clinical strength things like, what's that super antiperspirant that one of you guys was using? Do you remember the name of it?
I think it was Lisa's.
Certain Dry, I think, is one of them. Certain Dry spelled DRI. That'd be one to try. Would cornstarch help with setting? Possibly. Don't use it to cook with afterwards, though. Can you tell me the safest way to clean out ears at home? Do you also do OBGYN in your practice? We don't. We don't do any. Now, see, with my background being emergency medicine, well, we do gynecology. We do all of, well, not all of gynecology. We don't do surgery, but all of outpatient primary care gynecology. We don't do obstetrics, though. And actually, I have not. Well, I have had obstetrics training. I've delivered babies, and in fact, you just saw one of them. Did that in residency, but was not trained for that to be what I do. Family medicine, some of them train to deliver babies, but we don't. Yeah, we don't do that. Yes, Sarah, you be sure to tell him. And BooBoo, use the cornstarch for cooking afterwards. Yeah, make gravy interesting. We'll leave that between them. Cheryl, oh, you like that comment? Okay, so this has been good. I appreciate you guys. Where can you find this afterwards? People who are patrons like BooBoo Kitty at the $3 level and higher per month have access to all of our archived videos, and they also have access to videos that just never make it to the main YouTube channel. Don't make it live on it, but are private with follow-up. Like just today, we did put out a picture of Karen's scarf. You guys remember Karen who had the cyst on her cheek that we took out? Looks wonderful, by the way. It's healing up very nicely. So if you guys want to see things like that, that's through Patreon. You find it at, well, how would you find our Patreon? You could go to Patreon and search for Auburn Medical Group, or you could just go to patreon.com/Auburn Medical Group. That'd be another way. So thanks again, guys. It's been great. Look forward to doing that super chat sometime when somebody chooses to figure out how to make it work and see what it's like. I'm going to go ahead and finish now. Good night.